Joining us now, President and CEO of Biotechnology Innovation Organization, Dr. Michelle McMurry-Heath, and President and CEO of University Hospital in Newark, New Jersey, Dr. Shereef Elnahal. Doctors, good morning to you both. Dr. McMurry-Heath, let me begin with you with the broad question of why we're failing to get these shots into people's arms. We had the triumphant moment when the vaccine was approved, it got the emergency use authorization, began to enter the arms of some of our healthcare workers. But why is the process now slow? Why has it taken so long to get these out? The product is there, they're just not being distributed and administered.
Well, quite simply, we had a national vaccine effort, but we didn't have a national vaccination effort. You know, public health experts have been telling us for months that it's not the same to develop the vaccine as it is to get the actual shots into arms. And we know this. We know this from past vaccination efforts. You have to do public communication. You have to make sure that states, and we've been talking to many of the governors, have the resources that they need, not just to train personnel and give the shots, but to be able to track, for example, use the IT system that the government is using to track who's been vaccinated. State officials need to be trained in this system so that they can use it effectively. And none of the support resources have been made available in that way. So, you know, while it's too early and probably pointless to get into a blame game, it is clear that we need to deliver resources to the states so that they're able to not just have the vaccine sitting in warehouses, but actually be able to deliver the vaccine to those who need it.
Dr. Elnahal, how is the process going at your hospital in Newark? Is it a speedy process? Do you have frustrations? What more do you need as a hospital?
So thank you so much for having me on again. First of all, I think it's going okay only because our state health department stepped in and allowed us to replace the delayed Pfizer doses with Moderna doses. We have a very efficient system that we've been able to set up because we've been closely connected to the state health department. But Dr. McMurry-Heath is right. Hospitals, healthcare systems, clinics, instead of being blamed, should have more technical assistance to be able to administer these vaccines efficiently. It's not a simple process. You not only have to administer the vaccine, but you have to observe everyone for 15 minutes to make sure there's no severe allergic reaction that occurs. And then, of course, all the logistics around storage and distribution is falling on states and healthcare systems when really the federal government should be stepping up with more assistance, folks on the ground, and people helping us out. And unfortunately, that's not happening yet. And as you're seeing with the results, less than 5 million people across the country have been vaccinated, far short of the 20 million goal that was supposed to be by the end of 2020.
So, Dr. Elnahal, you mentioned the term delayed Pfizer doses. Why are they being delayed? We know they're there. Why aren't they getting to you?
Well, unfortunately, the state of New Jersey did not get the allocation that they expected. And as a result, that has downstream effects. That affects healthcare workers and people who are set to get the vaccine. These are scheduled folks that we had weeks in advance to be able to get it. And so we had to do a quick swap between Pfizer to Moderna, again, because of the quick work that our under-resourced state health department had to do. And so unfortunately, as you're seeing, the state health departments, healthcare systems, are not getting the assistance they need from the federal government. And that really needs to change. We're talking about now a new variant in 4 states that could increase the R1, the actual metric that spreads the virus significantly by, around 30% in terms of transmissibility at least. And so that means we really have to step up vaccination. We have to really ramp up the fire hose, which is the vaccine, against the ever-spreading fire, which is the virus.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.